And now we can start with our lecturing part. We all know the term brain drain, the emigration of professionals to countries with better opportunities. But it seems that here in Southeast Europe, we also have something that could be called startup drain, where founders needed to move their startups abroad in order to scale. How to change that? We will hear from our first speaker today. He is coming all the way from London Institute for Healthcare Engineering, thanks to British Embassy. Please welcome on stage Tony Kypreos.
Gagosi. I hope you're all excited as I am to join us at the Healthtech Adria conference. And firstly, a thank you to the School of Medicine and Katerina and Petra, and also, of course, to Marco for organizing with Nucleus. Really a world-class conference. Seeing all the speakers, seeing you here today is really good. Also, my personal thanks to Vesna Gabilovic here in the front, who's always accompanied me. I was here just 2 weeks ago in Zagreb, and also to Andrea Kovac at the British Embassy. I had a really good time actually investigating the healthcare innovation ecosystem, and some of the things I'm going to talk about today came from that learning. So it's so good to be back here in Split. So why do I say healthcare is the pinnacle of innovation? So I think it's actually the hardest climb to make, and actually the innovation has the greatest societal impact. So really, it's the pinnacle of innovation. And the good news is, and I would say this, Southeast Europe has all the ingredients that you need to actually make that climb, to get to the summit. Right, so first of all, we have a powerful ecosystem just in this room. You don't even have to go across the whole of Southeast Europe. Just in this room, we have who we need in terms of the skills and capabilities. So please put your hands up first of all, and I say first of all because I think it's the most important group. If you're involved at all as a healthcare professional, as a clinician, any contact with the patient in any way, hands up please. Brilliant, I'd say at least a quarter. That's excellent, really, really good. And unlike any other startup in any other sector, your role is so valuable in the next step. Second one, and there might be an overlap here, I'm sure. Who's in academia doing research in some way? Hands up. Yeah, great. About a third of you are in academia. And who's in a startup team or wants to join a startup or is planning? Great. I'm not quite sure if it's the same people in all three so far, but I think there's an overlap. And then the fourth group, who's an investor, an accelerator, private sector, corporate in some way? Oh, good. See, they're very keen, most in the front now. That's really, really good. So the ones with the startups, keep a note of this group. And the last one is, who's in government, ministry, national, EU, in some sort of way, policymaker? Lady there, up there, a few here. Great. There's a more select group in that group. So this is the ecosystem. You have this all in your room. So this conference is about turning this mix of capabilities, roles, expertise into action. I'm sure, as Marco said earlier, you're going to have all the people here that you can mix with and share those ideas. So this is the waggle dance of the honeybee. And when bees find nectar, they return to the hive and perform this dance. And it's very precise. It's like 17 degrees southeast of the sun, 1,280 meters, you will find the nectar source. And as if it's regulated, all the other bees follow those instructions. But not all the other bees. 5%, or even less than 5%, ignore the dance. And many never return. They get lost and they starve or whatever. But some do, and they're the ones that discovered the entirely new nectar sources. And without them, the hive would starve. So what's that got to do with healthcare? Well, I think there's an analogy there. In health tech innovation, things work in a similar way. We absolutely need the disciplined expert workers, scientists, clinicians, regulators, and the contribution, of course, of patients in co-design. And they build the capability and scale. But we also need the pioneers. And we don't need that many of them, but a small select group. And they could be both workers and pioneers. It could be an overlap. And they explore, they take the risks. They sometimes fail, but sometimes they bring back breakthroughs. So this is quite a unique ecosystem where we really do need that core group of experts, clinicians, medical practitioners, scientists, but we also need that breakthrough group to bring back those breakthroughs. And without both, the hive and the ecosystem, it cannot thrive. So what I think is other industries climb hills, but healthcare innovation, it climbs mountains. And why do I say this? Well, healthcare innovation is really unique. You have complex buying decisions. You have many, many stakeholders. You have regulatory and reimbursement hurdles. And most importantly, you're not buying a new shirt or an airline ticket. There's no room for error here. You can't do perpetual beta like software startups. So you really have to make sure you're correct. You have to be careful how you experiment, hence the importance of regulations for efficacy and safety, because lives are at stake. And of course, when you climb a mountain, say it's the pinnacle Everest, and no one sprints to the top of Everest. You climb in stages, you build base camps, and you have to ascend in a way that's safe and in sequence. And you build these camps from base camp to camp 4. Camp 4 could be preclinical evidence, pilots, real-world data, procurement pathways, all of these things. So think of this conference and the people you're going to meet here as the camp building. Each camp reduces risk for the next step, okay? So you start at the base, right at the beginning. It could be a clinical unmet need. And you need to reach the summit, which is a new gold standard of care, but with real adoption. Okay, so all of these stages have to be taken, and people have different roles to take at each camp. But you also need Sherpas, people who know the path. People like Mark over there, he's a Sherpa. And later you'll hear, just after me, from Alexandra Love, who's going to talk about the UK ecosystem, and later on, Carl Hartlen, who's going to talk about cross-border medtech, and they'll show you what real Sherpas look like in practice. And that's why we have accelerators, that's why we have all these capabilities, that's why we have mentors to help you along the pathway with people who have maybe done it before you and know the paths. That's a picture from my garden where it's migrating geese. And when geese fly, they fly in a V formation. Each bird benefits from the uplift of the one in front, and they rotate leadership, the hardest role at the tip. And again, that's how there's an analogy with how healthcare innovation works. Some days the founder leads, other days the clinician or product designer, they take the point and they keep rotating. And we rely much more on multifunctional teams and expertise in our startups and ventures than in other sectors. Clinicians define the standards of care, engineers and scientists, they build the solutions, regulators are involved in validating them, investors fuel them, and governments and policymakers play a key role in enabling them or sometimes making difficulty for them. If any one of these drops out of formation, the whole flock struggles. But when we fly together, we go further than we can alone. So this is not a sort of thing that you can build in your bedroom like Instagram was built, for example. This needs a lot of collaboration, more funding, and more careful development than other startups. But let's get grounded. It's all very nice and theoretical and jolly, but let's get a bit grounded. NetHub conducted a small survey of founders who have actually left the hive. They've gone away and they've built their new colonies elsewhere. So they didn't even start in Croatia or in Bosnia or Serbia. They've left and gone elsewhere, right at the beginning of their health tech journey. And let's explore the sort of things that they fed back as to why they did that. So these are a couple of quotes that I picked out of the research that Marco provided me. And you can sort of hear the frustration in their words. But really, these aren't failures of imagination, they're failures of systems. They're not failures of scientific competence. That's all here. There's some breakpoints that are maybe undermining or limiting the potential. So they're failures of systems, not failures of creativity, talent, or scientific endeavor. But the same survey shows hope. There's hope for the ingenuity, and there's also hope for ecosystem development and transformation. And if a couple of beavers can change the route of a river, then I'm sure the people in this room can transform and change some of the barriers we're going to encounter. And nothing wrong with beavers, they're very impressed with them, but we can do even better. So let's go into a bit more detail and into specifics, because we have to know the specifics in order to be able to address them. And a lot of this information came from the people I met, from the interviews I had, but most importantly from published papers that all of you can pick up and read. One in particular from Petra Kranikic from the University of Rijeka is a very good paper, and I really recommend that you take a look at it. So we have, Croatia has world-class science, and we're talking, and when I say Croatia, I'm trying to talk about Southeast Europe, but most of my exposure has been with Croatia most recently. So Croatia has world-class science, and I've seen it, and you all know it, but it's trapped in silos. University-industry collaboration ranks amongst the lowest in the whole of Europe. IP ownership is often unclear, leaving researchers and investors uncertain of which pathway to go down. And at technology transfer offices, I just observe very talented, capable people really working hard as much as they can, but often half a person, one person, two people, very often working on project funding and R&D grants. And they simply don't have the scale or mandate to unlock the potential. There's also a cultural gap. Many brilliant researchers, and I've met several of them, simply aren't exposed to entrepreneurship at an early stage, and the risk of leaving academia is too high. And meanwhile, the talent pool, as we heard before, is shrinking. I just saw that over 1,200 doctors have left Croatia in the last decade. So these are real concerns for a country that's relatively small. And then let's look if we do develop innovation, even if when innovation is ready, we could say that the healthcare system struggles to absorb them. So only 1 in 20 medical students think Croatia system is ready for digital health. And clinical trials are underfunded. If you just compare Slovenia next door, they attract 12 times per capita the investment in clinical studies than Croatia. So it's very interesting. Even within Southeast Europe, there's quite a lot of fragmentation. And these, again, are not competence, skills, talent, motivational barriers. They're structural barriers. Okay? But there's also progress and potential. And I think one of the key things is, do you have sophisticated, advanced, capable investors to invest in deep tech? You may have some that can invest, but they tend to go for the more simple apps or e-commerce or these sort of things, which I think shouldn't be where a country with your deep tech and scientific integrity has. But to be able to fuel these more complex, longer stage of evidence ventures, you need some really capable investors. I'm very pleased that Vesna Deep Tech Ventures are here. I think, is that you here? Which one is, oh, I thought somebody here might be. I think we're going to meet them tomorrow if they're not here today. But that's a really good move. So they're in Slovenia and Croatia. It's a sizable fund, and I think it's valuable to have that. In fact, I met Rona Medical to do surgical robotics in my last visit, and I thought that was world-class. So you can create world-class ventures if you have the right investors, if you have the right enablement. The next three areas are things that I read about being strategic guidelines. And these themselves don't create ventures in practice, but they can reduce the friction and the barriers in terms of creating them. So you have to have that as a foundation as well. And the last point, I'll take questions at the end to see if it's a good or a bad one, but I just think that a country of 3.5 million people needs to have, particularly in translation, some coherent and regular approach, particularly to transition in medical devices. These regulations are quite standard. You don't need to reinvent the wheel. And even in the UK, a very large market, there's a lot of things that are being done which enable us to do things together in a clear way between universities. And we're talking about very, very big universities as well. So I think potentially a national center of excellence for tech transfer in medical regulated devices would be a good idea. But again, I'm very interested in talking to all of you in terms of what you think and how that should be done. So we looked at insects, we looked at birds, let's look at plants now. Let's look at how bamboo grows. So bamboo spends many, many years underground building roots. And then when the conditions are right, it can grow 30 meters in just a few weeks. And that's an amazing sort of natural phenomenon. So you're probably thinking, what has this to do with healthcare innovation in Southeast Europe? But again, I'll get there. Again, I see an analogy. In health tech, our roots are the deep R&D focused on, and when I say deep R&D, it's not theoretical research. I think we've got to be a lot better at understanding the customer unmet need and the patient need. So focused on gaps and unmet needs. So some sort of directional research and applied research, multi-center trials, quality management systems, health technology assessments, data governance, and trusted partnerships. These are the roots that aren't just, they're not really visible, but they have to be there. And so the message is clear. Without doing the unseen work now, we can't expect to see that really. Have I gone too far? Oops, I've lost my slides. How do I go forward? Yeah, they'll. Great, and one more, please. That's it. So, yeah, so I was getting to my point of what has it got to do with Southeast Europe? So, so we have to build the roots and build these capabilities now, but then don't be surprised if in 5 years' time you see not just 1 or 5 or 10, but really a massive growth in the ventures coming out. It can be a real hockey stick effect, and we've seen that ourselves in the things that we've done in the UK. And so, what are the key lessons and the messages? So healthcare innovation is unique. It needs expert skills, expertise, teamwork, and a viable healthcare innovation system. And I think in Croatia, from what I've seen, some of the most difficult parts that are difficult to emulate are actually here. There's some other bits that need to be maybe transformed and disentangled. So from bees, we value pioneers and expert operators. Everyone is essential, especially in the healthcare professionals that interact with the patient. From geese, flying formation, you work together. You're going to need much more transdisciplinary teams in startups in health tech and healthcare than any other venture or sector that I know of. And by working that way and understanding having the leaders in each of those segments, you'll be able to build your team and climb that innovation mountain. And from bamboo, that's more for the policymakers and the deans and the universities. You have to invest in the ecosystem roots, and sometimes maybe even key people in certain positions need to be changed. And that happens a lot in UK universities where the market environment changes and the regulatory process have changed and you need to adapt some stuff. You've got to look at the necessary bottlenecks because that's what's blocking really good potential coming through. And then you can scale not just nationally or regionally, but even globally. And just please keep these lenses in your mind as you work across the different sessions and you network with the speakers and each other. So over the next 2 days, please keep asking, am I a specialist worker bee, a pioneer, or can I be both? Where do I fit in the V formation? How do I fit into a team? Can I be an advisor? Can I help in one particular stage? Do I want to go full-time? Do I want to keep my academic role as well? And you can do both. And how can I help strengthen the roots of the ecosystem? And right after me, Alexandra Love there will be talking about the UK healthcare system, and I'm sure you're going to see lots of valuable insights for comparison, because we have all been through these struggles and we have our own in different ways. So please engage with the ecosystem and AI sessions, the patient-centric design, learn from UK and Korean playbooks, and connect with investors ahead of the NetHub Catalyst pitches. And as I said, you do have everything you need, even just in this conference right here. And a special thanks again to NetHub team and also to the School of Medicine here to making this conference possible. Don't underestimate how valuable these conferences are in bringing people together and spotlighting, and this collaboration, this interface is very valuable. And I personally look forward to speaking with many of you over the next 2 days. I'll be here and available. Ask me any tough questions. I don't know if I can answer them, but I'll try my best. And like I said, I wish you a great success in climbing that healthcare innovation mountain in the future.